Let's take a look at this picture. We are all familiar with this. In psychiatric nursing, this is a word portrait of a person in 4 areas. And this is useful in learning more about oneself to indicate how well one person knows himself or herself as he communicates with others. Let's take an even more closer look at this picture. This is what we call the Johari Window, a tool for self-awareness, personal development, and understanding relationship. Johari Window is a psychological tool created by Joseph Loft and Harry Ingham in 1955 from UCLA. It is simple and a useful tool for understanding and training self-awareness, personal development, and improving communication. The Johari window is best described by naming the 4 panes or area, or sometimes we can call it panel or quadrant. Let's name them. At the left upper, we will name the first panel as open. And at the left lower, we will call it as hidden. Now let's go to the right upper. Let's call it as the blind pane. And let's call it as unknown at the right lower. Now further, the window is being derived and described by the self descriptor at the upper horizontal line and others at the left vertical line. Now these two will intersect and they will be further described as known at the left and unknown at the right as per the descriptor self. That means you. At the left side, you know, and at the right side, you don't know or unknown to self. Further, the descriptor others is further described as the upper is known, known to others, and the lower is unknown to others. Now, the 4 panes will be described with greater clarity if we will now intersect the self descriptor and the others descriptor at the above and at the left. Let's now do that. The open pane will now be described as I know, because this is described by the self-known area above, and you know as others and known at the left. We will call this pane as open window or the open pane I know you know. And below that is I know from the self, known to self, that is I know, and you don't know, unknown to others. That is what we call the hidden. And at the right upper, we will call this and describe this as the blind. I don't know because self is unknown at the upper portion and you know at the other's left portion. That is the third right upper is what we call the blind or the I don't know, you know panel. Finally, the unknown area can be best described as I don't know from the self-unknown above, and you also don't know from the others unknown area. By this, we have described the 4 quadrants, panes or panel or area of the Johari window, such as open, hidden, blind, and unknown. Let us try to know the importance of the Johari window with respect to self-awareness of nurses. It is said that Johari window works by helping us, nurses, to know the differences between how we see ourselves and how others see us. That means we can evaluate ourselves. And at all times, the very goal of Johari window model would be to enlarge the open area. And this is, as you may look into the illustration, the open area is now being broadened rather. compared to the blind, the unknown, and the hidden area. And widening the open area can be done by three processes. One is that it is important you have to receive a feedback from others about yourself. Two is to adopt a new behaviors. And third would be the self-disclosure. Now, it is said that the very goal would be to increase the open area. But we have to consider that this is without prejudice to disclosing too much personal information about yourself. That is, we will be having an issue about trust. Other than enlarging the open area, when we do that, the size of the hidden area is said to be lower or lessened. Together with the unknown area, it will be smaller. And these are the very goal when Johari window is of concern. And this is the relationship of self-awareness with the Johari window. In our next discussion, let's try to know more about what is the meaning or what are the meanings of enlarging each and every panel of the Johari window. At this point, let us try to analyze the reflection of behavior changes in relation with the panel of each window according to an individualized assessment of self-description in Johari window. Let us describe the behavior of a person with a wide open window. Let's give it a try. If the window pane, particularly the open area, is broad and wide, then how will you describe a person? First, the person is said to be sensitive to the needs of self and of others. Second, that person will have a high degree of mutual trust, concern, and respect. These are all good descriptors. The person who has a wide open window will be very objective and will be having a meaningful relations. And finally, he is a person who is very open and authentic. Well, these are all sweet words. These are all good description of a good person. And this is the person that we're talking about. So we better dream of having a broader or a larger open window pane. Let us try to describe an individual assessment in Johari window of those who have a large and a broader blind area. This person is said to be described as having distrust in others' competence. Wow, that's a negative word. He is also having a rigid opinion. That's difficult to deal with. And he fears of having a failure. Now, this is the kind of person that we're talking about. So, having a larger blind area is a not so good of a descriptor of an individual assessment in Johari window. Again, he will be distrustful, he will have a rigid opinion, and he fears of failing. How about the description of a person who has been assessed to have a broader hidden pain in Johari window? How are we going to describe that kind of person? For a person who have a larger hidden area, he is a person who is very distrustful. He is masking to maintain a personal image. Wow, these are big words. He is a person who fears of exposure for his own inadequacies. And he is a person who has an indifferent behavior. And this is the kind of a person we're talking about. He is masking himself. This is a negative description of a person having a larger hidden area. So Let us try to assess ourselves. Do we belong here? Or do we know somebody who belongs here? Let's continue. Finally, what about if a person do have a larger unknown area description in Johari Window? How are we going to describe him? He's a person who has an indifferent behavior. He is a low risk taking person and withdrawn by nature. These are all negative, as you may notice. Non-communicative as well. This person is very silent. And for him, there's no importance to interpersonal relationship. He needs not to communicate nor have a relationship with somebody. He is withdrawn, low risk taking, indifferent behavior, non-communicative. As you may notice, these are all a not so good description of a person who has a larger unknown area. Now let's take a look at who he is. This is a person with a larger unknown area. Finally, from what we have learned from the previous discussion and previous evaluation of each pane of Johari Window, we have learned that we have to improve as we deal with our client and be serious with self-awareness. And the Johari Window will be a very useful tool to guide us in dealing with others. That is, our very goal would be to broaden or widen our open window pane or area or quadrant. And this can be accomplished by the following. Number one, you have to listen to feedback and evaluate yourself upon learning the areas where you have to improve. Second, you have to adapt to a new behavior. If you have learned from the self-awareness that there is a need for you to change. And finally, self-disclosure will help us to learn our behavior. That is only to a minimum level and will depend on your trust issue and concern. This is a description of a larger open area, which is the goal in self-awareness in relation with Johari Window. Here are some salient points or points to consider when we are working with self-awareness before we engage in any interaction with our client. Number one, we have to keep a diary or a journal identifying our feelings from time to time and the circumstances as to what triggers our feeling in our workplace. And that's an important thing to consider. Second to that is that if there is any formal clinical supervision where there will be discussion of feelings with respect to challenging client or situation, you really have to gain insight. If there is a need for a new approach, you have to listen to that. You have to attend to a discussion of that personal feelings. The third consideration would be if it is possible to seek an alternative point of view. You have to empathize with the client. That means you have to put yourself into the shoe of the client and from time to time at least think that you are in the shoes of your client and you will know how it feels like to be like them. Another important is that you don't have to be critical of yourself or the others. You just have to accept them as part of yourself. Treat them as a person and accord them with respect. And finally, if there's a need for you to talk to someone to trust or somebody you trust, you can do it by sharing your experience and feelings. All of the above mentioned points or tips are something that you have to consider when you are trying to do the self-awareness technique in order for you to prepare yourself to what we call the battlefield or when you are about to immerse yourself into a working zone of psychiatric nursing field.
That's all, folks. This has been your Nurse Radiologico Guro
saying thank you for watching and enjoy studying.